Mike and Maureen, thank you so much for joining us today.
Thank you for having us.
That documentary is so powerful. If you haven't watched it, I really recommend you taking the 30 minutes to just, it's eye-opening and it's heartbreaking. And I wanted to help to understand how have you been able to be so open about Alex's experience, about your own family's journey? I know it can't be easy.
Well, when we first found out it was heroin and things were, going the wrong way, we had a family meeting, and sort of as a group, we decided that we knew that our lives would change forever, no matter what was going to happen. And we weren't going to be quiet about it. We were going to tell people, as opposed to stuff it in a drawer like so many people did with the stigma attached.
So much stigma. Mm-hmm.
So from that point, everything else that happened, starting the charity and becoming involved in.
Tell me about that.
Yeah, Maureen.
Alex, the foundation you started in his memory.
Well, we wanted to take some meaning out of it, and we wanted to help others who were struggling with the same thing that we had struggled with, the families and the individuals, who have the disorder. So we decided to start a nonprofit, and we've been we've given a lot of support to the Casper Emergency Shelter in Cambridge. Alex spent a lot of time there. It's a wet shelter, so you can go there even when you're using. We've provided them with backpacks filled with things that the people living on the street might need, and they've given them out from their outreach van and within the shelter. We've given them financial donations. We've helped them with coat drives and shoe drives and things like that to help them out.
And you have discussions, you were telling me backstage, about grief for families who are dealing with this, because when you watch this documentary, it's so clear you're not the only one. We know that, but it really brings it home. There's an entire generation that's being lost.
It really is an entire generation. In our community, which is a small community just outside of Boston, we counted one night with another friend of ours, and we counted 30 people within a group of friends who had passed away. So they weren't even all strangers to each other. And there were others, but we counted 30 people that we knew that had passed away. So and I don't even know the impact it must have on the other youth in the city. To lose, when you're in high school, to lose several friends, during your high school years. I can't even imagine how kids are coping with that.
I'm a mother. My daughters are 28 and 24, and I know as a parent, when you hit these rough patches, you can feel so alone. But I can't even imagine what you went through. Have things gotten better? I'm wondering, you've testified before the state legislature here in Massachusetts. Have you seen things improve?
Well, we can't say what's happening right now, but when, first 1 or 2 times there was overdoses, there wasn't a system in place at all. Your best friend was a competent emergency room nurse who would slip you a piece of paper and a couple of phone numbers. You need a place for detox or rehab or whatever. And you learn, we had to self-learn.
Because this was 15 years ago.
Right, and so in and out of relapse and in and out of the house and on the street, back in, and through all that, you develop a list of, whether it's, Worcester, Brockton, Georgetown, you can go on and on, all the affordable places that you can send someone. If you're working parents, you don't have the resources to send them off to the $15,000 a month type of, And there was no system. I think it's improved somewhat. I think that personal physicians are more in tune with addiction, and maybe there's more advancement in identifying people at risk, young people at risk, and hopefully at some point the medical community and the education section of our society will work together and work better on the at-risk, because when you talk to people, you find out that, yes, there are ways to identify, and maybe, you can prevent. It's all about prevention. Sorry, I'm jumping around a little bit.
Well, Maureen, we were talking about this backstage, how there is very often a mental health component that is going unaddressed, and so you'll have people, young people, maybe even Alex, who are self-medicating.
Yes, there's almost, I've learned that there's almost always an underlying mental health issue. It could be something like bipolar, it could be PTSD, it could be as simple as anxiety or ADD. But that's what drives them not to try it, because kids are kids and they try it because their friends are trying it. But that's what leads you, I think, to become addicted to it, because you suddenly feel, I've had people say, that's the first time I felt good in my whole life. That's the best I've ever felt when I was on that drug. So you're going to go back to it because it's making you feel better. Yeah. So I think mental health issues are a big, big component of addiction.
It took 3 or 4 years for us to hear the term dual diagnosis, which was enlightening and refreshing.
You know, explain to everyone what that is.
Hopefully they would already know.
But people might be watching at home who don't.
But,
yeah.
you know, like looking back and knowing what the recovery rates are and the relapse rates are, people who are just going in and out of treatment and getting detoxed and sitting in a bed for 2 weeks and then put back on the street without the mental health, aspect, they're going to relapse for sure.
So you believe that's a huge part in solving this epidemic.
Yeah, and I came across a quote yesterday by Desmond Tutu that I think says it perfectly. And it said, there comes a point where we have to stop pulling people out of the river and go upstream and find out why they're falling in. And to me, and I don't know what his reference was in saying it, but that's what we're doing. We're putting them into detox, then they come out, they might go into rehab if they're lucky, then they come out, and there's no process, there's no place for them to go sometimes to get support, and they're not always getting the best treatment. They're not always getting evidence-based treatment. Medication-assisted treatment. A lot of places won't.
There's a lot of stigma to that.
Yes, absolutely, and it's known to be effective, but a lot of rehabs won't use it, won't let you use it. So there's still, things have improved, I think, but there's still a long way to go. A long way to go.
Mike, what do you say to parents who think this will never happen to them? They don't need to worry about this.
Those are the hardest nuts to crack when you're trying to advocate, whether it's in a cocktail party or at a social event. And for the person who's adamant that they don't have a problem with addiction or they never will, I kind of break it down to, well, at least you're a taxpayer, right? And if you had any idea how much money is being spent on ambulatory care and emergency rooms and mass health, you would be interested, at least from that point of view, And when we've done community things, sometimes it's hard to get those parents who feel like, they don't have that problem. And we were those parents. We never thought we'd have to deal with this.
Never.
You do all the things that baby boomers were supposed to do, and raising your kids, and a little peer pressure and a couple of bad decisions, and all these young people are in a club that they can't get out of for a variety of reasons. So you try to go back to your question, express that in a way that's, you're not being too aggressive or insulting to someone, but you do, I won't mention the town, we went to a meeting that a local hospital had put together at a town hall, and there was the police chief, there was the fire chief, there was 5 nurses that lived in that town, and there was no one from the town, and a few other people like Maureen and I, so it was like...
So you're preaching to the choir.
They're in denial, but there's so many people in denial about it, right? And that town has the lowest heroin overdose in the state, which was at the time 12. I don't know if, hopefully it hasn't gone any lower, but it certainly could have. Mm-hmm. So in an environment like that, how can you think you don't have a problem? And how do you break that? We're just 2 people living our lives, so that's bigger than us.
Before we go to the questions from Slido, I did, go ahead, Maureen.
I was just going to say, when you bring up addiction to somebody who doesn't think they have, that they need to know about it, 9 out of 10 times I have found that they've said, oh, yeah, my cousin, my friend, my next door neighbor, yeah, they were addicted, they had a problem. So it is more widespread than people realize.
You've learned so much over this 15-year period. I know Alex died 5 years ago. What do you know now that you wish you'd known then?
Oh, goodness. I wish I had known more about how to recognize the signs and what the signs were. I wish I knew more about mental health, anxiety, and that sort of thing that did have an effect on Alex. I wish I knew more about what you do because even once we found out, I didn't know what we were supposed to do. There isn't a manual that you can pick up that says this is what you do, step 1, step 2. So you learn by doing, you call your friends. Luckily, we had a lot of friends who were dealing with the same issue. And
So you learn from one another.
so you would call someone and, where do I go? What do I do?
Got a question that came in. It says, if you go upstream, you find the opiate lobby and our own legislators caused this epidemic. How does that make you feel? And what do we do about that?
Frustrated, a little angry, because I do think there were a lot of people that were complicit in it. I know if you watch the documentary, there's a segment on the pharmaceutical companies and how they promoted OxyContin, and the general public was totally unaware of it, totally unaware of how dangerous it was and how addictive it was, and even doctors were unaware of it often.
Fighting the lobbies in Washington from the grassroots level is tough, even through your elected representatives. It's all the negativity that's been around Washington the last 10 years or so when it comes to lobbying, and almost every problem in this country probably can be traced back to some kind of lobbyist activity.
Let's take this question. The person asks, are recovery coaches helpful, and should insurers cover them?
I don't have too much direct information on them. I would suspect they could be helpful, especially if you're at the beginning, because as I said, you don't know where you're supposed to turn. When Alex needed help, he would go to a psych ER in Cambridge, and even there, they would hand him a phone and a list of telephone numbers and say, make some phone calls, see if you can find yourself a bed. So a recovery coach can kind of...
In what other illness do you hand the person? Here's the list of doctors. Figure it out yourself.
No other illness that I've come across is treated that way. So it could help, because if they can at least point you in the right direction and get you started and give you information that it might take you a couple of years to accumulate otherwise.
Mm-hmm.
One of the things related to this that we've learned about is, so if you have a loved one with any other disease, there's a specialty hospital, the medical community is prepared, everything's lined up, and the insurance companies are with those programs based on your insurance company and whatever's been negotiated.
And there's no limits on treatment, right?
Right.
For diabetes
when it comes,
or heart disease.
So I've had, at one similar thing that we went to like this, there was an MD next to me, and I asked him on the mic, so in 10 or 20 years, do you see addiction hospitals being built and specialized research, treatments, and sharing the information, which is another huge issue in addiction? Is that going to come to fruition? I know, how is the medical community working towards those goals to offer, something? So if Alex was in program A, and then 2 years later he's in program B, and then 3 years later he's in program C, none of those people are talking to each other about what was done, how he was treated, how he responded. And also, as parents or loved ones or whoever's helping you, pushing you in the door, you can't tell any of these facilities how good they are. What's their batting average? What's their rate of recovery? What's their financial situation? Are they just a charlatan shack, or is it a place that's actually doing the job? So from both sides of that, there is no answer right now. And we know a lot of the people that we've talked to at Harvard Medical and McLean's and Mass General, those people are all Johnny on the spot. They all know, they're but even as individuals, MDs and psychiatric MDs can only do what they can do as individuals. Somehow, somewhere, it has to pull together. And I hate to say this, but I think the federal government has to be the precipitory and make it happen, at least to start to make it happen.
Mike, Maureen, thank you so much for coming and sharing your story with us. Thank my wonderful
Thank you very much for
guests.
having us.